Imagine waking up one morning and something just feels off. You can't quite explain it. Maybe you're more forgetful than usual. Maybe you feel confused, anxious, or strangely detached from your surroundings. It's easy to brush off moments like this, to blame stress, age, or a bad night's sleep. But for many people, these seemingly harmless changes can be the very first signs of dementia beginning to show. We often think dementia develops slowly, over years. But the truth is, some of its earliest symptoms can appear almost overnight. One day, everything feels normal the next. You notice you're not processing things the same way. Your emotions shift, your focus fades, or your behavior feels unfamiliar even to yourself. These are not random changes. They are the brain's quiet alarms. Dementia isn't just about forgetting names or losing memory. It's a gradual breakdown of how the brain manages thought, emotion, movement, and perception. In its earliest stages, the symptoms are often subtle, so subtle that family members might not recognize them until patterns begin to emerge. That's why awareness is so powerful. Catching these silent signs early can give you a real chance to slow progression and protect brain function. In this video, we'll uncover 6 quiet but crucial symptoms of dementia that can appear suddenly, often before memory loss becomes obvious. You'll learn how to tell the difference between ordinary aging and real cognitive change, and what actions to take right away to support your brain. Because the earlier you understand what your brain is trying to tell you, the more time you have to protect your independence, your clarity, and your sense of self. Stay with me to the end. This may be one of the most important health conversations you'll ever have. And if brain health matters to you, take a moment to like this video and subscribe to MediMint, your weekly guide to living sharp, calm, and strong after 50. Symptom has shown. Sudden confusion or disorientation. Have you ever walked into a familiar room and suddenly forgotten why you went there? Or opened a familiar app on your phone only to stare blankly at it for a few moments, unsure what to do next? Everyone experiences occasional confusion, especially when tired or stressed. But when disorientation or confusion appears suddenly and repeatedly, it can be an early sign of dementia. Sudden confusion often affects short-term memory and situational awareness. The brain struggles to process information in real time, which makes it difficult to keep track of dates, locations, or sequences of events. A person might forget where they placed everyday items, become lost in a neighborhood they've known for years, or lose track of the day or time. This isn't just being forgetful, it's the brain's communication network faltering. Dementia affects the hippocampus and temporal lobes, areas responsible for forming and retrieving memories. When these regions are compromised, connections between neurons weaken, and information is harder to encode or recall. This can create sudden gaps in awareness, making previously simple tasks confusing or overwhelming. It's important to differentiate normal aging from a warning sign. Everyone sometimes forgets where they left their keys or gets momentarily confused in a busy day. But repeated episodes that interfere with daily life, cause anxiety, or make familiar activities difficult suggest a deeper cognitive change. There are ways to support the brain and reduce the impact of sudden disorientation. Maintaining a structured daily routine helps the brain anticipate and process information more efficiently. Using calendars, notes, or labels around the home can provide helpful cues. Physical activity like walking or light aerobics increases blood flow to the brain, supporting neuronal health. Mental exercises, puzzles, memory games, or learning new skills keep neural pathways active and adaptable. Adequate sleep and hydration also play a critical role in cognitive function, helping the brain consolidate memory and process information effectively. Recognizing sudden confusion early allows you to take meaningful action. Discussing these experiences with a healthcare provider can help identify whether they are harmless lapses or an early symptom of dementia. Acting promptly gives you the best chance to slow progression and maintain independence. Even when confusion appears overnight, awareness and small interventions can make a real difference, keeping your brain stronger and your daily life more manageable. Symptom #2. Abrupt mood swings or anxiety. Have you ever noticed a sudden shift in your own emotions or in someone you care about without any clear reason? One moment calm, the next irritable or anxious, or perhaps suddenly sad or withdrawn. Everyone experiences mood changes occasionally, but when these swings happen frequently, intensely, or without an obvious trigger, they can be an early sign of dementia. Mood and personality changes are often one of the first clues that something is affecting the brain beyond normal aging. Dementia can impact areas of the brain responsible for regulating emotions, particularly the frontal lobes and amygdala. These regions help manage stress, impulse control, and social behavior. When they are compromised, emotional responses can become unpredictable. A person who was previously patient may react irritably to minor frustrations, while someone who was outgoing may suddenly avoid social interaction. Anxiety can also emerge unexpectedly. The person may feel a persistent sense of unease or worry, sometimes about trivial matters, or become unusually fearful in familiar settings. These emotional changes occur because the brain struggles to interpret and respond to situations correctly. Over time, the person may withdraw from loved ones or favorite activities, compounding feelings of isolation and frustration. Distinguishing these changes from normal aging is crucial. While everyone can become stressed or sad occasionally, dementia-related mood changes are consistent, noticeable, and out of character. They often occur alongside other cognitive changes, like memory lapses or difficulty concentrating. Supporting someone experiencing these shifts requires patience and understanding. Avoid criticism or confrontation. Instead, provide reassurance and maintain a predictable daily routine. Gentle physical activity, like walking or stretching, can help regulate mood by increasing blood flow and supporting neurotransmitter balance. Engaging in calming hobbies, listening to music, or practicing mindfulness can also reduce stress and improve emotional stability. If you notice abrupt mood swings or unexplained anxiety in yourself or a loved one, take it seriously. Discuss these changes with a healthcare provider to rule out dementia or other underlying conditions. Early recognition allows for strategies that preserve emotional well-being and maintain quality of life, helping both the individual and their family navigate these changes with confidence and care. Symptom #3. Changes in sleep patterns. Sleep disturbances are one of the silent early signs of dementia that many people overlook. You might notice that you or a loved one suddenly struggles to fall asleep, wakes repeatedly during the night, or experiences vivid dreams that disturb rest. Some people may sleep during the day but feel restless at night, a reversal of normal sleep-wake cycles. While occasional sleeplessness is common, persistent changes in sleep patterns can indicate early cognitive changes. Dementia affects regions of the brain that regulate the circadian rhythm, the internal clock controlling sleep, and wakefulness, primarily the hypothalamus. When these systems are disrupted, the body's natural signals for rest and activity become inconsistent. This can lead to nighttime restlessness, frequent awakenings, or early morning wakefulness, which in turn can exacerbate memory issues, confusion, and mood disturbances during the day. It's important to differentiate normal age-related changes from dementia-related disruptions. Mild sleep difficulties are typical as people age, but sudden, significant shifts, such as being unable to sleep at night while feeling drowsy all day, or new insomnia paired with cognitive changes, are warning signs. Sleep loss can worsen attention, decision-making, and emotional regulation, creating a cycle that accelerates cognitive decline. There are practical steps to support healthier sleep. Maintaining a consistent bedtime and wake-up schedule reinforces the body's internal clock. Limiting caffeine and heavy meals in the evening, keeping the bedroom cool and dark, and avoiding screens before bed can improve sleep quality. Exposure to natural daylight during the day helps reset circadian rhythm, while gentle evening routines such as reading or light stretching signal the body it's time to rest. Physical activity during the day also promotes deeper, more restorative sleep, while relaxation techniques like deep breathing or meditation can calm the mind and reduce nighttime anxiety. If you notice persistent or sudden changes in sleep patterns, take them seriously. Discuss them with a healthcare provider, especially if they accompany memory lapses, confusion, or mood swings. Early intervention can improve sleep quality and support overall cognitive health, helping the brain function more efficiently and maintain clarity and alertness during the day. Symptom #4. Loss of interest or apathy. A subtle but important early sign of dementia is a noticeable loss of interest in activities that once brought joy. Someone who loved gardening, reading, socializing, or pursuing hobbies may suddenly seem indifferent, unmotivated, or emotionally flat. Unlike normal occasional disinterest, this apathy persists and begins to affect daily life, relationships, and overall engagement. Apathy in dementia is linked to changes in the frontal lobes and basal ganglia, areas of the brain responsible for motivation, reward processing, and goal-directed behavior. As these regions are affected, the brain's ability to initiate and sustain activity declines. The person may not feel energized to complete familiar tasks or may stop caring about things that used to be important, not because of laziness, but because the neural circuits driving motivation are impaired. It's important to distinguish apathy from depression. While depression involves sadness, guilt, or hopelessness, apathy in dementia is more about a lack of initiative or emotional engagement, even if mood appears neutral. The person may seem disconnected or disengaged, but not overtly sad or anxious. Practical strategies can help counteract early apathy. Encourage structured daily routines that incorporate meaningful activities, even in small doses. Gentle prompts or participation alongside family members can stimulate engagement. Social interaction, light exercise, and mentally stimulating activities, puzzles, music, or creative tasks, can activate reward centers in the brain and improve motivation. Maintaining a supportive environment is also crucial. Avoid criticism or pressure, which can increase withdrawal. Instead, provide reassurance, celebrate small successes, and offer choices to empower the person, allowing them to feel in control despite cognitive changes. Recognizing loss of interest early is key. It signals that the brain's motivational systems are changing, and timely intervention can help maintain independence, mood, and quality of life. Awareness allows families to adapt activities, keep engagement meaningful, and reduce the emotional impact of this silent symptom of dementia. Symptom #5, subtle speech or word, finding problems. Have you ever known exactly what you want to say, but the right word just doesn't come to mind? Everyone experiences occasional tip-of-the-tongue moments, but when word-finding difficulties occur frequently or interfere with communication, it may be an early sign of dementia. In the initial stages, dementia can affect the language centers of the brain, particularly in the left temporal lobe. This disruption makes it harder to recall words, form sentences, or follow conversations. A person may pause mid-sentence, substitute incorrect words, or repeat phrases without realizing it. Over time, conversations that were once effortless may become challenging and frustrating. Unlike normal age-related language lapses, which are occasional and easily corrected, dementia-related speech difficulties are persistent and noticeable. Friends or family may notice repeated questions, trouble following discussions, or avoidance of conversations altogether. Even simple social interactions may require more effort, leading to withdrawal and social isolation. Supporting someone with early speech changes involves patience and understanding. Speak slowly, use clear language, and allow extra time for responses. Encouraging reading aloud, storytelling, or word games stimulates the brain's language networks. These activities strengthen connections in the temporal and frontal lobes, helping maintain communication skills. Physical health also plays a role. Adequate sleep, hydration, and regular exercise support overall brain function and can help preserve cognitive clarity. Engaging in new learning experiences, a language course, hobby, or creative project, can provide additional stimulation to maintain verbal fluency. If subtle speech difficulties are becoming more frequent or disruptive, it's important to mention them to a healthcare provider. Early recognition allows interventions, lifestyle adjustments, and therapies that can slow decline and maintain effective communication. Persistent word-finding problems are not a reflection of intelligence or effort. They are the brain signaling a need for support. Recognizing them early helps protect independence, relationships, and quality of life, turning a silent symptom into an opportunity for proactive care. Symptom #6, sudden clumsiness or poor coordination. One of the less obvious early signs of dementia is a sudden change in movement or coordination. Someone who was once steady and precise may start tripping over their own feet, dropping objects, or struggling with tasks that require fine motor skills, like buttoning a shirt or pouring a drink. While occasional clumsiness is normal, frequent or unexplained difficulty with simple movements can indicate early cognitive changes. These symptoms arise because dementia affects regions of the brain responsible for motor control and spatial awareness, particularly the cerebellum and parietal lobes. Neuronal communication in these areas may weaken, causing the brain to misjudge distance, timing, or force. As a result, even routine activities can become awkward or risky. For example, the person might miscalculate steps when walking, knock over a cup of water, or stumble on familiar terrain. It's important to differentiate this from age-related changes. Slower movements can happen naturally with age, but dementia-related clumsiness is usually sudden, frequent, and noticeable in multiple daily tasks. This symptom may also appear alongside other cognitive changes, such as memory lapses, confusion, or mood shifts, reinforcing the need for attention. To support coordination and reduce risk, maintaining regular physical activity is essential. Walking, stretching, balance exercises, or light resistance training improve muscle strength, flexibility, and brain-muscle communication. Activities like Tai Chi, yoga, or dancing challenge balance and coordination while stimulating multiple areas of the brain simultaneously. Creating a safe environment also helps. Remove tripping hazards, keep walkways clear, and ensure adequate lighting at home. Using stable support surfaces or rails can prevent falls while allowing independence. If you notice sudden clumsiness or decreased coordination, it's important to consult a healthcare provider. Early recognition of this symptom can help address safety, provide targeted interventions, and support overall cognitive and physical health. Even subtle changes in movement are a message from the brain. By noticing and responding early, you can protect both mobility and independence, ensuring that daily life remains safe and functional. Dementia often begins quietly, with subtle changes that can go unnoticed until they start affecting daily life. From sudden confusion and mood swings to sleep disruptions, loss of interest, language difficulties, and even clumsiness, these silent symptoms are the brain's early signals that something is changing. Recognizing them early can make all the difference. If you've noticed any of these signs in yourself or someone you care about, don't ignore them. Early awareness allows for timely medical evaluation, diagnosis, and intervention, which can slow progression and help maintain independence. Small, consistent steps, like engaging in mental exercises, maintaining physical activity, following a healthy diet, getting restorative sleep, and staying socially connected, support brain health and improve quality of life. It's also important to approach these changes with patience and empathy. People experiencing early dementia are not being difficult or careless. Their brains are struggling to process information in ways that were once automatic. Gentle guidance, reassurance, and supportive routines can help them navigate daily life with dignity and confidence. At MediMint, we believe that knowledge is power. Understanding the early signs of dementia equips you to take proactive steps, protect memory, and maintain your well-being. Every action you take, from noticing subtle changes to adjusting lifestyle habits, contributes to stronger cognitive resilience and a better quality of life for years to come. If this video helped you identify warning signs or offered strategies for prevention, please like it and share it with someone who might benefit. And don't forget to subscribe to MediMint for more evidence-based guidance on maintaining brain health, preventing cognitive decline, and living strong, sharp, and independent after 50. Your brain is the story of your life, your memories, your personality, your experiences. Protect it, nurture it, and listen to it. With awareness, care, and action, you can face these silent symptoms with confidence and continue to live fully and meaningfully, no matter your age.